Hi everyone. A very warm welcome to all. As you all know, we have all gathered here today to discuss this issue. If you all can go ahead and introduce, that would be good.
Hi, my name is Bob. I am MD in a hospital. I have come here as a representative of this hospital.
Hi, I am Jessica. Taking treatment for the last 5 years.
Hi, I am Joseph, working as an administrator for the hospital from the past 15 years.
Hi, I am John. I am a 60-year-old man and I've been taking treatment for the last 7 years.
Hi, I am Tyler, working as a technical developer.
It is really good to know about everyone. Okay, we have a recent change in policies for the healthcare. We are considering cutting the funds for the hospital by 20%.
What kind of changes do you recommend that we make so that the change of funds will have least effect?
I recommend that all the people in the medical board of our hospital to sit together and arrange a plan to cope up with this new budget.
Okay, I understand.
We should also consider the HIPAA regulations, which prohibit having web-based health record systems.
What are the HIPAA regulations and how come it can cause problems?
HIPAA regulations provide national standards to protect individuals' medical records and other personal health information held by entities and gives the patients an array of rights with respect to the information.
Apart from that, it also protects the privacy of personal information and sets limits and conditions on the uses and disclosures without patient authorization.
I am surprised to hear all this. Well, in my case, my records got exchanged, so why is the privacy measure not taken care of?
Well, it is not that measures were not taken care of in your case, but I guess it's just some technical fault.
Although we make sure all the applications work the best. But such cases like yours can happen. 1 in a million.
I am not trying to make an excuse here, but mistakes do happen, which can be either a technical fault or fault by the staff.
I don't think it's a good reasoning, because it can lead to serious consequences. What if I was given the wrong medication? I could even die.
Please, Mr. John, keep yourself calm.
Well, we are not here to fight, rather to discuss the positives and negatives. I do agree with you, but that is what we are paid to. Each and every patient of ours is taken care of to the best of my knowledge.
Huh? None of your statements are convincing me. What if I would have died? Who would have taken care of my family? Would the hospital take the responsibility of it?
Well, Mr. John, you are extending it too far, I guess. You are exaggerating your scenario. It can be easily figured out by our administration department and the other departments involved, if at all any mistakes do occur.
Well, if you guys are so responsible for your patients, then who will take care of all the insurance charges that I had to pay off? I was charged thousands of dollars for my medication, and for a disease I was not suffering from. In fact, I am lucky that I won't die, even though getting the wrong medication.
Certainly, Mr. John, I understand that. You were troubled in making all the payments that you were not supposed to pay off, but you can approach to the consumer court to get all your lures back from the hospital.
Oh, so you mean, after spending so much of my money now, I should spend my time and effort in fighting a case with the hospital? What if I lose the case in the consumer court? It is again wastage of time and money.
Well, if it's not your mistake, definitely you should get back your money.
Because of the disease, I was claimed to have lost of my job on account of health hazards. I was asked to not show up in the office just because my disease could be fatal. Would you guys provide me another job and take care of my expenses as well?
Well, we can't help you to find a job, and we do understand that you have to suffer from the consequences, but we can only learn from this mistake and try not to repeat.
No, you guys can't get away so easily saying that you will not repeat such mistakes. When you take charge of a person, you must show responsibility, or else you have to close the hospital. If you guys really feel my pain, provide with me the lawyer who can fight the case without any charges and help me to get my money back.
No, that's not possible.
What do you mean? You guys can commit mistakes, but are not ready to rectify it. It's awful. I think it's very irresponsible behavior on the behalf of medical fraternity. My wife left me. I am not able to support my kids' education anymore. My job is gone. What else is left for me to lose? Still, you expect me to understand. You just cannot imagine my situation, and you are happily defending your medical department.
Well, Mr. John, you are not trying to understand that I am not defending anyone. But before making a decision, we need to do a thorough case study on it.
Well, we are just hearing on your behalf, and before committing to you, we need to hear the entire case. We should also know the hospital. We have to speak to their staff as well, and then decide on your case. It's not so easy to promise on a discussion meeting like this.
I don't mind if you want to study my case more in depth, but I'd expect you guys to give me justice. Because I had to pay for something that I didn't commit, and I had to suffer a lot.
Fault can also not be on the medical staff, rather just the technical fault. So we have to look into that.
Well, it can be anything either, and I don't think you should just blame it on the technical department.
Well, I am not blaming it on the technical department. I am just making the statement that the fault can lie anywhere, so we will have to look into that.
I don't care whose fault it is. That is your job to figure it out. But all I care is about that. I need justice.
Definitely. As far as providing justice is concerned, we will try to work it out, and I would rather make any statements saying that it was technical fault or medical fault.
After all, our patients are our responsibility.
Well, I have been hearing from a long time now regarding Mr. John's case, and I have been keenly observing what everyone sitting here in this room have to say about it. Now I would like to present my problem before you guys. I have had arthritis for 5 years. Since I was 17-year-old, I have had to focus more energy on it than anything else I can remember. I was based in Australia, but happened to be in Austin for conference. I woke one morning at the hotel, vomiting and severe pain. I know what arthritis pain, but that pain was different. My conference organizer, who knows nothing about my medical background, except that I had arthritis, had to keep me awake long enough so I could give him the information to fill out the form.
You don't have any of your medical reports with you?
No, I don't. Because of the lack of information, they had to wait until I awake long enough. And they hoped by treating me. When I woke up, I was in a hospital room, with the doctors standing over me. They told me I had a kidney stone and needed surgery right away.
Oh, is it?
I had gone through surgery and ended up spending 10 days in the hospital. Most of it waiting for treatment, because the doctors didn't have the medical information they needed. I now realize the importance of the accurate records and timely transfer of medical information, because we now have access to this technology. I feel the electronic records might help so many people.
I am grateful that you shared your experience with us. There is a need of digitizing medical records, and also want to discuss the positives and negatives of this topic. The hardest part of my job is not taking care of patients, but the business side of medicine. I spend more time doing paperwork than treating patients. In most cases, I will not be able to complete the paperwork, and I have to take it home and have to work on those charts.
Well, I also do agree with you, doctor. In complex cases, where the patient is being treated by 10 different doctors, just looking at the electronic records, each doctor will have better understanding about the progress of treatment in other areas.
Well, being a technical person, I would always stand for use of technology, but who will pay for the heavy, upfront costs of moving to digital medical records, which include purchase of hardware and software, selecting and contracting costs and installation expenses?
Well, if it's for a good reason, cost and other issues should be discussed and taken care of. What do you have to say about it, Mr. Joseph?
In order to overcome the high-cost barriers, especially the purchase costs associated with electronic medical records, may require incentives from the government, such as low-interest loans or funding programs.
But it will cost a lot just for the startup costs, such as the system administration, control, maintenance, and support in order to keep it working effectively and efficiently. These costs include the long-term expenditures incurred in monitoring, modifying, upgrading and maintaining electronic medical records, which will be significant. Taking all these into consideration, it's going to be a burden for just one person. So a good approach would be to bring in system administrator, one person just to maintain the software, and software developers. Altogether I am looking around 6 people. This is just a rough estimate.
Well, I guess you have a plan in your mind. But we need to discuss more to implement it. And you also have to put forward all the costs and management issues you were talking about.
Well, I am more concerned to first decide what are the positives and negatives to it.
A certain level of computer skills by both suppliers and the physicians is required. Further, there are still some technical problems with electronic medical records, which lead to complaints from physicians, and they need to be improved.
Oh, what are all the technical problems? Do you think that can affect the physicians?
Security is a major issue, according to me in this case. What if someone crashes into the system?
In my case, also it was electronic record that were being used, but I suffered from security theft issue. How do you think technology is going to make any change or improvement?
We need to employ proper training to all the staff members to reduce the issues related to the security.
In my previous experiences, I have seen doctors and medical staff using electronic record systems. During that time, electronic medical record system itself had usability issues.
What kind of issues are you talking about?
Issues in the sense that, let's say for example, the physicians had to allocate a lot of time and effort to master these systems. They had to learn the electronic medical record systems so effectively and efficiently, which they took as a burden.
Well, we need to provide training and learning period before the system is brought into the implementation in the hospital.
I definitely agree with the doctor, because it's always a risk to use a new system unless you are properly trained on it.
Well, I also feel high reliability is very important for a system dealing with patient information, and many physicians are concerned about the temporary loss of access to patient records if computers crash, viruses attack, or the power fails. Moreover, some fear the possibility of record loss due to an unknown technical defect in the system. Further, reliability problems will lead to financial loss, such as in the form of an increase in ongoing costs.
Well, I certainly understand what you are trying to put forward here. But, let me tell you, even if the system losses, there won't be loss of information, because it is stored in the servers and they are backed up every day. As a technical team, we will take necessary steps to ensure that there is no record loss. This comes into picture only when the system is matured.
Since it's very important to keep patient information safe, because it could create legal issues. What, according to you, are the necessary steps to be taken to ensure this?
Well, proper security standards will be taken to ensure there won't be any loss of patient information, and the data shouldn't be accessible to those who are not authorized to obtain it.
So, you mean the system will have separate authorization for separate staff members?
What do you mean by that, doctor?
Well, what I am trying to say here is things that you as a head can assess, or me as a doctor can assess, that will not be available to a nurse or a ward attendant.
Absolutely, doctor. That is what I am trying to explain here. that there are different levels of authorization access to the systems. There will be separate logins to each staff member, and only the information relating to your particular staff member will be available on his access.
Well, I have heard the entire conversation. I am not a technical person, but I have a question here. The task of digiting medical equipment is going to be beneficial to what extent? Do you think what Mr. John suffered will not repeat again?
Well, no one can generate 100% results, but we will put our 100% efforts to make sure we commit what we're aiming at.
Well, your words seem to be convincing, but let's see how it comes up.
Let's all of us try our best and see how it goes.
As a patient, it would be nice to have information security and confidentiality included in the system. Can these be included?
Yes, it's our responsibility to secure our patient information and keep their records safe.
Well, let me summarize our discussion. Is there anything we need to include?
No, I feel this could be a better learning curve for the doctors, in turn benefiting patients.
I don't see any problems either.
It is hard to get everything right in the first iteration, but we are willing to put our complete efforts in ensuring everything runs smoothly.
I do agree that this item will take time to get to that matured level. Eventually, it will be beneficial to everyone.
As everyone accepted, let's go ahead and put our efforts into making this a reality. Thanks everyone for giving your inputs, suggestions and ideas. This is one step towards the betterment of the community that we are living in.